experts rarely agree, but when it comes to MS, I think you could change rare to never. Well, hello and welcome to another episode of You and Me and Multiple Sclerosis. My name is Pam, and I've been living with multiple sclerosis for 38 years. And if you've been watching my recent videos, I've been looking at different ways that we can improve our general health so that we stay as healthy as possible despite our MS. And I've been looking at different factors that can get in the way of that. But I've started to think about how MS is really part of a system, right? Our whole body is one system. And it's very hard to see how a person could have something as widespread through the body as MS with all of its nerve problems without that affecting some other important parts of our body. So I thought I would start looking at different internal organs and systems and look at the research that tells us whether we have more or less chance of problems with that because of our MS. And I thought I would start with something that's kind of central, kind of important. We only have one. We'd better keep it healthy, and that is the heart. Now I'm going to look at a few things that I found online that talk about MS and your heart. But I'll tell you right now, don't expect all of the evidence to point the same way and all of the experts to be in agreement. But let's look at what I found. I realized I think I've spent more time searching and scrolling through search results for this topic than any one that I've done so far. There's an awful lot on the brain, and there's an awful lot on MS, and there's an awful lot on heart health, but try to put all those three things together and you suddenly don't have all that much. But let me review with you parts of some of the articles that I found, and I hope that you'll be able to see that nothing all that definitive seems to be known, though there's an awful lot that's very thought-provoking. The first article I looked at was way back in 2015, in December of 2015, in Neurologist magazine. It was called Cardiovascular Dysfunction in Multiple Sclerosis, and I will put the full links to all these articles down below. Rest assured, I'm not going to go over every word of every article, but just to give you a general idea of some of the things I found, the abstract for this one says multiple sclerosis can affect cardiovascular function in a variety of ways, leading to abnormalities in blood pressure response, heart rate, heart rhythm, left ventricular systolic function, and may cause pulmonary edema or cardiomyopathy. And just so you know, cardiomyopathy refers to problems with your heart muscle that can make it harder for your heart to pump blood. So pretty serious condition. Cardiovascular dysfunction in MS is incompletely understood. That's a key phrase right there. And likely underrecognized. That's another key phrase. You may see some similar things as we go forward. I just jumped down here to the conclusions. Cardiovascular abnormalities may be clinical or subclinical and can lead to sudden death in some cases. Sounds pretty serious. Neurologists should be aware of the clinical presentation and pathophysiology of cardiovascular dysfunction in MS so as to ameliorate cardiovascular symptoms, prevent cardiovascular complications, and choose therapeutic agents that do not worsen other underlying cardiovascular disease. The next one I looked at was in 2018. It was February 22nd, 2018. It was published in Multiple Sclerosis News Today. MS patients tend to have more heart problems, need better exams, study shows. It says that researchers found that patients with multiple sclerosis have increased heart problems suggestive of an intrinsic myocardial disease and would benefit from cardiovascular examinations using more advanced techniques. The study impaired cardiac function in patients with multiple sclerosis by comparison with normal subjects was published in the journal Scientific Reports. I'm not sure how far afield they had to go to get normal people, but if I ever see one, I'll let you know. An assessment of cardiovascular function in MS patients is rarely performed, and even when it is, it usually relies on conventional imaging techniques such as 2D echocardiography and tissue Doppler that might fail to detect subtle changes. Therefore, it's important to deepen our knowledge about the types of heart problems and to what extent they occur in MS patients. A few studies have shown that MS is associated with an increased risk of hospital admission for stroke, heart attack, and heart failure in the first year of diagnosis, suggesting that early diagnosis of cardiovascular impairments might be crucial to start preventive care in these patients. Now researchers undertook a comprehensive cardiovascular assessment of patients with MS. They compared several cardiovascular parameters in 67 people with MS and 36 age and sex-matched healthy control subjects. Both MS patients and healthy controls had an equal incidence of cardiovascular risk factors, such as arterial hypertension, high lipids in the blood, smoking habits, and obesity. Researchers found that both the right and left sides of the heart had more impairments in MS patients than when compared to healthy people. Those with MS had a reduced left ventricular systolic when the heart beats and diastolic when the heart rests between beats function, reduced left atrial function, impaired right ventricular systolic activity, and increased systolic pulmonary artery pressure. That all sounds pretty serious. Here's a graph of their findings. It says here on the caption, the three-dimensional left ventricular ejection fraction was the thing on the left, and so you can see that according to the legend here, the MS patients are in blue and the controls are in orange. And so you can see that the ejection function, so how much blood is actually being pumped, is greater in the control group than in the MS group for all three columns, although admittedly the second and the third don't show as dramatic a difference as the left-hand one, but they're all, in my mind, significant because they all add up to something that is a little bit worrying. And since the heart is so critically important, this does seem to me something that ought to be followed up on. It says here that the team suggests that a higher incidence of cardiovascular problems in MS might be due to the presence of mutated muscle proteins, which are also present in the myocardium, the heart muscle. Another reason might be the higher frequency of cardiac risk factors in people with MS, such as smoking, high lipid levels in the blood, and lack of exercise. And here I honestly don't know whether that's necessarily going to be true, because we understand it that lack of exercise is almost a pandemic, at least in this country and probably globally. People are just not getting enough exercise. And smoking has really decreased in recent years, at least in the United States. So I'm not really sure they've done a lot of comparisons that would hold up for folks with MS versus some hypothetical control group. But they say that the study shows that MS patients have increased cardiac impairments linked to intrinsic myocardial disease. The results call attention to the importance of performing a comprehensive cardiovascular exam in people with MS using more advanced techniques that can help to prevent life-threatening heart failure. And then they end with a quote from the study. These findings are significant for the daily clinical practice by emphasizing that this young and active population should receive the best standard of care from a multidisciplinary team, including a cardiologist. I think we'll see by the end of this that that is really true, that both the neurology and cardiology need to be involved if there's any suspicion at all that a person is having some kind of problem with their heart or their cardiovascular system. Then going ahead to May of 2020, there's an article in JAMA, the Journal of the American Medical Association, evaluating the risk of macrovascular events and mortality among people with multiple sclerosis in England. So they limited the population to just those in England. Sometimes that's good because it eliminates some factors that otherwise, if you go into too many different countries and cultures, you're not controlling for certain factors like diet or climate. And we'll just go through the abstract a little bit here. The question that they ask is, do people with multiple sclerosis have an increased risk of macrovascular disease and mortality? And here are their findings. In this population-based matched cohort study of 84,823 people with or without multiple sclerosis, those with MS were associated with an increased risk of macrovascular disease even after controlling for socio-demographic variables and traditional vascular risk factors. People with multiple sclerosis were also associated with a 3.5-fold increased risk of all-cause mortality and a 1.5-fold increased risk of cardiovascular disease mortality. Treatment with statins was associated with lower mortality rates among people with multiple sclerosis. But statins, of course, are not the answer to everything. We have seen that statins have health effects. But at any rate, the meaning of their study, according to them, is that these findings show that multiple sclerosis is associated with an increased risk of cardiovascular and cerebrovascular disease, so disease of the blood vessels in the brain, which is not completely accounted for by traditional vascular risk factors. So once again, incompletely understood. Okay, so now here's an article coming out of Elsevier, the Multiple Sclerosis and Related Disorders Journal, and this is in November of 2021. The prevalence of myocardial infarction, so heart attack, among multiple sclerosis patients, a systematic review and meta-analysis. This is a literature study that looks at everything that's been published in the field. Here's the abstract. People with MS are suggested to have a higher death rate compared to the overall population. Increased risk and incidence of cardiovascular diseases is a possible contributing factor here, as these patients are suggested to be more prone to early death due to myocardial infarction. And that's the interesting thing to me. Is the death directly attributable to heart problems? And is that related to having MS? And as they say, this systematic review aims to describe the prevalence of myocardial infarction among people with MS in comparison to the non-MS population. And according to them, we included 19 studies comprising 44 to 66,616 participants. The overall prevalence of MI was 1.7% among persons with MS. The pooled odds ratio estimate for MI was 1.41 in persons with MS compared to the MS-free population. And their conclusion is that results of this systematic review confirm the increased risk of MI among persons with MS. Consequently, cardiovascular diseases should be considered in the management of these patients. And they didn't say it, but this is the kind of paper where they would say more study or more research is necessary because the conclusions, while suggestive, are certainly not conclusive. And those of us with MS know that almost nothing is conclusive, though much is indeed suggestive. And then we got one in November of 2021, Heart Disease and MS, Understanding the Connection. And this was published in My MS Team on their website. Studies indicate that men with MS seem to experience heart disease at a similar rate as their peers without MS, whereas women with MS get certain cardiovascular studies at higher rates. I tried to look into that. I wasn't really clear. What I was able to find almost seemed like it said the opposite. So I'm sorry, but I didn't get to the bottom of it even by clicking on that link that they give there. If I figure it out, I'll let you know. This includes acute coronary syndrome, they're 28% higher, cerebrovascular disease, 59% higher, and macrovascular disease, 32% higher. These are significant numbers. and I'd really like to know more about this. One study indicated that people with MS are 60% more likely to have a myocardial infarction or heart attack than those in the general population. I mean, that is a riveting statistic. You would think there would be study upon study that would be giving us more information. And they say further on, they say that the relationship between MS and heart disease goes both ways. Studies show that high blood pressure and heart disease have adverse effects on the brain for people with MS. Individuals with MS and cardiovascular comorbidities, the presence of two or more diseases at the same time, appear to experience neurodegenerative tissue injury and brain atrophy. This research highlights the importance of addressing heart disease in people with MS. Well, yeah, we're kind of getting that idea. And then here's another one. Lest you think that the research just fizzled out and there's nothing recent, we're getting close now. May 26, 2022. Multiple sclerosis and cardiovascular disease, what's the link? And this is published out of Very Well Health, and as they say, MS has also been linked to a higher risk of cardiovascular disease, including problems like heart attack, stroke, and heart failure. The reasons aren't yet well understood, though they may involve inflammation, shared risk factors, and more. What's the link between MS and heart issues? According to this article, several studies have suggested an association between MS and heart disease, and research is ongoing to understand their relationships. Elevated triglyceride and LDL cholesterol, considered bad, have been associated with worse MS symptoms and more brain imaging abnormalities. MS has also been associated with higher rates of stroke, heart attack, and death from cardiovascular disease. The reasons for this are, okay, you might have guessed it, still being investigated, but scientists have suggested links between inflammation and heart disease, as well as genetic mutations associated with MS, affecting the heart muscle and CVD risk. In addition, some shared risk factors for MS and heart disease, such as smoking and obesity, may contribute to these findings. And then they refer back to a 2020 study that looked at over 84,000 people for more than 10 years, compared the health of those with and without an MS diagnosis. People with MS were approximately 50% more likely to die of heart disease, 28% more likely to have a heart attack, and 59% more likely to have a stroke. Why have I never heard this before? My doctors never said a thing, although I have had my heart looked at for an unrelated reason, and I was pronounced to have a healthy heart, so maybe that's the reason why no one's ever followed up. But it might be worth your while to have that discussion with your neurologist if you're thinking that you might have any health impairment at all that affects your heart. You might want to take a look and make sure that there's nothing going on. As they say here, types of CVD linked to multiple sclerosis: heart attack, stroke, peripheral vascular disease, which is a slow progressive blood circulation disorder, heart failure, and heart imaging abnormalities. How you can recognize the symptoms, and this is important, especially if you've never had a doctor do any tests on your heart. Heart attack symptoms can include chest discomfort, shortness of breath, weakness, dizziness, and nausea. Arrhythmias can cause lightheadedness, fainting, palpitations, and weakness, and heart failure may cause shortness of breath, leg swelling, weight gain, fatigue, and exercise intolerance. Again, those seem like there's some overlap with just general MS symptoms, but if you have any doubt at all, any concern at all, please check with your doctor. Your primary care doctor might be of more help to you there in referring you to someone who could see you and maybe take the necessary tests. Again, stroke can have variable symptoms, including sudden weakness on one side of the body or face, difficulty speaking, and vision changes. Peripheral vascular disease typically presents with claudication, which is discomfort in the leg muscles with walking that is relieved with rest. And yeah, it is kind of maybe a little disconcerting how much overlap there is between these symptoms and ones that we assume are related to multiple sclerosis. So when in doubt, don't assume. That's my advice. And then in Health News, March 22nd, 2023, study shows connections between multiple sclerosis and heart disease. People with MS were 50% more likely to die from heart disease, researchers found. They were 28% more likely to have a heart attack and 59% more likely to have a stroke. These are similar or identical to numbers we just saw, so they're probably quoting the same studies. And we probably don't need to go into great detail about this one because it sounds like they're looking at the same studies, especially this paragraph here where it talks about the exams that show how blood flows through the heart and valves found that MS patients had more impairments on both sides of the heart compared to healthy people. I'd really want to look at that. If I can find more information about that, that would be very interesting to me because I just never have had a neurologist talk to me about my heart. It says here, the findings highlight the importance of comprehensive heart exams for people with MS, and I guess I'd second that. Advanced techniques can help prevent life-threatening heart diseases in patients who are at high risk. This preliminary research doesn't show that MS causes atherosclerosis, but a strong association between the two diseases is emerging according to Ochsner Health. More studies are needed. Here we go again. More studies are needed to understand the underlying processes that link these two conditions. And here are some video clips that get at something of the same general message about the connection between the brain and the heart, and particularly how that relates to people with MS.
Number one, the leading cause of death in MS is cardiovascular death. Now, this is true across most populations, but I want to call it out here because there's a lot of modifiable risk factors. And in the setting of someone impacted by MS, I don't want them to forget that they can impact their mortality by working on these cardiovascular risk factors. So these are things like paying attention to diabetes, high cholesterol, hypertension, morbid obesity, etc.
Sometimes we think of the brain and the heart as just unrelated, two separate things going on, but they're very closely connected and they really need each other. So we have a saying, if it's good for the brain, it's good for the heart, or if it's good for the heart, it's good for the brain. But think about the things that are bad, and they're bad for both. High blood pressure, the number one cause of strokes. Smoking, bad for you. Diabetes, high cholesterol, and the bad type of cholesterol. Physical activity, and obesity.
Now, in general, MS itself does not cause heart problems. However, there are rare exceptions to that. For example, some people with spinal cord lesions can have what's known as autonomic dysfunction or changes in the subconscious nervous system, and they could get things like lightheadedness or changes in heart rate, but it's not too common. Also, there are other things with specific multiple sclerosis medications, such as the S1P phosphate receptor modulators, such as Gilenya, Mayzent, and Zeposia, and they can cause a temporary reduction in heart rate or even rarely more serious problems like heart block and atrial fibrillation, but generally speaking, MS does not cause heart problems.
Well, I have a lot of respect for Dr. Bieber, so his dismissal of an increased risk for heart disease if you have MS made me wonder if something maybe has changed in the state of knowledge since these articles came out. And I thought, well, what better way to know what's going on than to go out to clinicaltrials.gov? Because then I would know all the current and recent and prospective trials that focus on MS and heart disease. So I searched clinicaltrials.gov for multiple sclerosis and heart. And interestingly, I suppose I could look at any number of other search terms, but interestingly, what I came up with were mostly studies that had to do with two basic areas. One, the relationship of exercise to multiple sclerosis, and two, the effect of particular medications that we use for MS, the effect of these medications on the heart. Here's a good example. I've got two studies here, One of them is on the effects of task-oriented training on functional mobility and fatigue in patients with multiple sclerosis. So they're testing basically your heart rate before and after exercise, different kinds of exercise, and what effect that might have on fatigue in multiple sclerosis. There were a number of them I found that were similar to that. They might involve high-intensity training or various kinds of exercise, and how that might affect fatigue specifically. And then the other kind here, long-term open-label multi-center study assessing long-term cardiovascular risks. But if you look over here, the drug that they're looking at is fingolimod. So in other words, they're trying to see whether fingolimod has any adverse effects on your heart. Well, having looked at all of this, I can only conclude that there seems to be a disconnect, and it's maybe a little bit not to our advantage, shall we say. I don't know the reason for it, but if I were to guess, I would say that it's possible that people who specialize in multiple sclerosis, they don't have more than a general knowledge of the heart. And people who specialize in diseases of the heart don't have any more than a general knowledge of multiple sclerosis. And there's so much going on in both fields that perhaps it just doesn't seem to be a very urgent matter on either side of the story to figure out what that linkage might be. I think that the best thing that we can do, as I've said many times, is to look after our general health and particularly our heart health. And on that score, that Very Well Health article did have some useful things to say on minimizing risk. Preventing cardiovascular disease is important for everyone, but those who are at higher risk of cardiovascular disease should pay close attention to managing controllable risk factors. Leading as healthy a lifestyle as possible is the first step. This includes eating a healthy diet, stopping smoking if you smoke, and exercising to the extent of your ability. So if we replace the word exercise with movement, perhaps that can be a little bit more achievable for us, because we might not be able to exercise, but we can all move. We can move in some way. And I just think keeping moving is so important for us for so many reasons. But it will keep your blood flowing properly, and perhaps that will help you with any impending heart issues that you might have developed if you just stayed perfectly still. It says here that MS can make exercising difficult, but regular exercising that gets the heart rate up, including activities like water aerobics and chair exercises, are beneficial. In addition to a healthy lifestyle, it's important to ensure that blood pressure, blood sugar, and cholesterol are controlled. Lifestyle can help with high blood pressure, diabetes, and high cholesterol, but medications are often needed. And then under other lifestyle factors, they say that cardiovascular disease can also be included by under-recognized lifestyle factors, including poor sleep habits and mental health conditions. So make sure to get adequate sleep and prioritize mental health for the best possible outcome. It's not easy, is it, to see a clear path here. I think the best advice really is just take good care of yourself, including your heart, because one never knows. Just because the state of the research right now says one thing doesn't mean that in 5 years or even less, we might get some study published that we might be seeing more evidence that the heart and MS are linked, or the evidence may continue to be somewhat inconclusive. In the meantime, all I can say is take really good care of yourself, and I will see you again in my next video.